Away from the police, let's talk health. Health workers in Jantuakrom, a remote farming community in the Wassa and Menfi West municipality of the Western region, say they are impressed with the services of Zipline drones medical services. According to the health workers, Zipline has positively impacted the lives of residents in the area. Managers of the CHIPS compound say the services of Zipline have made it very easy for them to have access to medications, especially anti-snake drugs, which formerly would have taken several days or weeks to get to their community. My colleague Samuel Kujobris was in that community and has filed this report.
This is Jantuakrom, a farming community, 3 hours drive from Asankragwa, the municipal capital of the Menfi West municipality of the Western region. This remote village is home to a tight-knit community of people who farm for a living. Their community is unfortunately connected by a terrible road network. The community has a CHIPS compound, which serves as the main source of healthcare for the people here and the many others surrounding this community. However, the CHIPS compound is plagued by several challenges. Ben Mieza is in charge of the Jantuakrom CHIPS compound.
Very challenging, but we are managing. Yes, very challenging. There's no light, and the staff do not have quarters for accommodation. So we are just managing, but it's challenging. Where we stay, we do not have permanent accommodation, so we use some of the facility as staff accommodation. And during that, we can't have space for both male and female when we are to detain people. For instance, somebody coming to labor and you need a space. A male too is occupying that same ward. It's either you decide the male to go home or to refer and attend to the delivery, or you let the delivery go ahead. It might be that the person might deliver on the way, and it's very bad. So we are just seeking that if it will be possible to get anybody to come and help us to have accommodation for staff, it will be very good for us.
Lack of electricity affects them badly because they are unable to store vaccines and other critical medicines.
We are supposed to vaccinate children every month. We have to move to the nearest community, that's Odankotoms, for vaccine. Come and use them. After that, you have to send it back, which also affects us. If in transport, there can be anything. If there is vaccine here, we'll use it and keep it. But because we don't have a vaccine fridge and light, you have to go and put the vaccine in the light. You can get accident on the way, and that is a fact. If we're having our own light, we're getting a fridge and we're putting our vaccines here. Even in some of the things that we use, especially oxytocin, they are supposed to be in a cold pack. We don't have light here, so there's no fridge for you to keep the oxy, and it's also a problem. So if you have light, so many things can be done, and health delivery will be very smooth for all of us.
The CHIPS compound, due to the distant nature of the community, had been battling with the difficulty in transporting their medical supplies, such as vaccines, to the facility. But today, with the drone services provided by Zipline, medical supplies, including vaccines, are supplied directly to the CHIPS compound, bypassing the poor road infrastructure that otherwise made it difficult to transport medical supplies.
As for that one, by God's grace, we have been enlisted on it. So our vaccines that we talk about, is the drone that brings to us some drugs. If we get shortage of drugs, we request and they bring it. So as for that one, incidentally and by God's grace and our municipal director, the health director and other people, by their help, we've been able to get that thing. So that's for that one, we thank them for that. But we are just seeking that they help us with the light, because as for that one, it is affecting us.
This CHIPS compound is faced with a lot of challenges, from inadequate rooms to cater for patients to not well structured maternity delivery bed. But there's a spark of hope here. It's because the drone services by Zipline has been serving this community adequately. The in charge is excited by this. Ben Mieza took me through how the drones deliver product to them.
So just in front of the facility, there is a space there. So they came for a survey and they saw that there are no trees there. The place is very plain. So when we request about in 30 minutes, 40 minutes, the drone will just come. And when it gets here, it gets down a little, open up, and the thing falls. We pick it, no damages. And as for that, we are grateful to whoever who brought it. Yes, it brings from vaccines to medication to family planning commodities. Anything that we need that they can provide, they bring it. Yes.
According to him, the drone services have helped them solve their essential needs.
Sometimes you put them in your vaccine carrier on the motorbike. As you are coming, some of the vaccine will get broken. Sometimes the paper on it that contains the batch numbers, they get deleted. And by the time you get here, you are frustrated. But for this, and sometimes you have to spend time. By the time you come, the people have come to queue up, and it's very bad because if somebody comes, the person keeps long, the person will not come back again, irrespective of the things that you tell the person. But for the drones, you just type it, papa, Jantuakrom chips, we need this. Within the next 30 minutes, the drone will be here. It forces you pick everything, no breakages, everything is there, and it is very convenient. So as for that one day, we cannot compromise on that.
A recent study by ID Insight, an advisory, data analytics and research organization with funding from the Bill and Melinda Gates Foundation, reviewed drone services decreased the number of days that facilities were without critical medical supplies by 21%. It shortened vaccine stock out by 60% and decreased people being turned down for vaccinations due to issues with inventory by 42%. Zipline's service also increased the types of medicines and supplies that were stocked at health facilities by 10%. So how many times do drones deliver services to Jantuakrom?
As many as you can, as many as you request, they come. As many, even a day. Sometimes you'll be doing CWC weighing, and maybe you are short of some vaccines. You call them within 30 minutes. You have it. You have, maybe you want to give a certain medication, but you have depleted your stock. Maybe medical staff have not brought it. You just send message to them, and within 30-40 minutes, the drone will be here, and you're okay.
To Ben Mieza, with the drone services, the future of healthcare delivery in rural Ghana looks promising.
We have a bright future with this drone system, and it has removed a lot of time wasting, a lot of breakages, and it's exciting. It's exciting because you just sit, just type to them, and sometimes they are customer care too. When you think that they are delaying, when you call them, immediately you call, they pick it and they inform you that this, and they are on point. When they tell you it will land on 10:30, you have your vaccine. So we have a brighter future with this drone system in the health sector.
For Mieza, whoever brought the idea must be praised.
Anybody who brought it, the person who thought of it, has done very good thing to us. Yes.
From the Ghana Health Service, led by the Director General, Dr. Insia Sari, and the Chief Director of the Ministry of Health, Sir J. Mensah, and various committees that have worked hard. The Parliamentary Subcommittee on Health, all have worked so hard and remain focused and dedicated in ensuring that the use of this important technology is now part of the health delivery architecture of our country.
Jantuakrom may be a remote farming community, but thanks to the dedication of the CHIPS compound staff and the innovative solution of Zipline and the government, the people of this community are able to live healthier and more connected lives. From Jantuakrom, for Joy News, I am Samuel Kojo Brace.